top of the vagina. The cervix is covered by a thin layer of tissue made up of cells. Cancer of the cervix, or cervical cancer, can develop when cells become abnormal. Most cases of cervical cancer are caused by infection with a virus called HPV, or human papillomavirus. The HPV virus can cause cells to become abnormal over time. One way to prevent HPV infection is by getting the HPV vaccine. You can also prevent cervical cancer by having regular screening tests and follow-up treatments if needed. Cervical cancer screening may include Pap tests, HPV tests, or both. Pap tests check for abnormal cells in your cervix. HPV tests check for the HPV virus. In both tests, cells are taken from the cervix in the same way and sent to a lab for testing. Cervical cancer screening is recommended starting at age 21. How often you're screened and which tests you have depends on your age and health history. It takes many years for cervical cancer to develop, so screening is recommended every 3 or 5 years for most people. Talk to your OBGYN about how often you should have screening. Pap test results show whether your cervical cells are normal or abnormal. There are different types of cell changes that range from mild to serious. HPV test results show whether you have a type of HPV that may cause cancer. A positive HPV test means that you have an HPV infection. Abnormal Pap tests and positive HPV tests do not mean you have cancer, but it may be a sign that cancer could develop later. After a positive HPV test or an abnormal Pap test, more tests may be needed. Follow-up tests can tell what type of HPV infection you have or how severe your cell changes are. In most people, the immune system clears the body of HPV before it causes disease. The cervical cells go back to normal. In other cases, treatment may be needed to remove the abnormal cells. There are several ways the cells can be removed. A few of the methods include LEEP, Loop Electrosurgical Excision Procedure, which uses a thin wire loop and electric energy to remove abnormal cells. Conization, which removes a cone-shaped piece of the cervix that contains the abnormal cells. Cryotherapy, which destroys abnormal cells by freezing them. Abnormal test results can seem scary, but they are no reason to panic. Simple tests and office treatments can